Hey guys, welcome back to my channel where we talk about running and we talk about physical therapy. Now today I wanted to discuss hip pain in runners. So if you're an athlete that has developed hip pain, especially the front of the hip, because that's where we most often see the hip pain in athletes and in physical therapy. So let's talk about what could be going on and what's likely the issue. So bear with me through a little bit of the hip joint anatomy and kinesiology, and then we'll get into what's going on in your hip and how to treat it and how to prevent further damage. So the hip joint, just like the shoulder, is a ball and socket joint, meaning it has a lot of degrees of freedom. It has a lot of, in other words, range of motion. It can move in all different planes. With more range of motion comes a more difficult time stabilizing for the muscles to stabilize that joint. So, as many of you may have heard of, the shoulder joint has what's called the rotator cuff. The rotator cuff is just a fancy name for deep, four deep muscles. Deep meaning not close to the skin, deep as in like very close to the joint. And they provide dynamic stabilization for the ball and socket joint. Um, so just like the shoulder, the hip has a similar rotator cuff. So when you look into the deep stabilizers of the hip joint, there's many deep stabilizers, just like there's many deep stabilizers of the shoulder. Just like the shoulder, there's a labrum of the hip joint. Labrum is just a fancy term for the cartilaginous ring that surrounds the socket, right? So let's say you have a socket, right? This is my hip, this is my pelvis, and this is my hip joint. So this is the big femur bone, and it articulates in all sorts of directions in the hip joint. There's a ring. So I keep mentioning this cartilage. Okay, so it's called your labrum, and likely what's going on in athletes more often than not, the hip pain is from a jamming of the, let's say this is the front of the hip, the ball and socket isn't stable enough to stay deep in that socket and centralized in that socket, so it keeps jamming into typically the front of the hip, the labrum. This can lead to micro tears in the labrum itself, or a full tear in the labrum itself. Now you're running into a little bone on bone issue, right? And that's not good. So there's no it's not a great blood supply to the cartilage. So take this injury kind of seriously. Take some time off. See your local professional if you need. Okay, now let's talk about what is typically why are we developing this pain? So let's talk about that. So, for example, we see this a lot in high school or college athletes that run around the track, and typically they run around the track counterclockwise, right? So they're always making left turns, and it's usually a lot. Now I'm speculating, but usually it's their right hip. And think about how much range of motion their right hip has to go to keep turning left, right? This is the socket, this is the femur, the ball, and it has to turn excessively into the socket. So what can we do about this? Now, more often than not, it's a rotator cuff of the hip. It's a stability issue, right? It's not central in the socket. Now think about it. If everything is tight in the front of the hip, it's going to keep pulling here. If things in the back of the hip are loose, so the rotator cuff muscles, the external rotators, right, aren't eccentrically strong enough to keep that ball and socket from rolling too far forward, right? External rotation would be the opposite. It would be rolling externally. But if you think about front of the hip is rotating internally, too strong, too fast, too hard. Things in the front of the hip are too tight. Things in the back of the hip are too weak. Okay? So, thank you for bearing with me through that, because that just lays the foundation of what could be going on in your hip, right? So, what have we learned? Potentially, our hip flexors could be tight, right? But the bigger issue I want you to focus on is your deep external rotator hip muscles are likely weak. So, your glute, right? Glute max. It extends your hip, but it also externally rotates your hip. Get your glute stronger. Do things like squeezing and holding. Make sure your glutes are firing. Tempo is another big component of activating those deep rotator cuff hip external rotators. What do I mean by that? If you're just doing external rotation for your hip and you're just not thinking about using deeper muscles, you're just going to use whatever is easiest. A lot of muscles can rotate the hip, but we want to focus on going slow and controlled and rotating the hip to get the deeper hip muscles firing. Okay? So and you're going to be able to do that a bit easier if you go in a slow and controlled manner. So slow down your strength training. Things like side plank clamshells, right? A clamshell is just hip external rotation. Slow and controlled, activating those deep rotator cuff of the hip external rotators. Okay? If you have any further questions on this, please leave a comment below. Leave a comment below on any questions that you may have. But I just wanted to drop this video. Went a little bit longer than I wanted it to go. But yeah, it's an instability of the hip. Typically is what we see in runners. So, another thing to keep in mind, core stiffness, right, will also help to stabilize and allow core stability, will allow better hip ability. So when you're doing your core exercises, go slow and controlled, and keep your core tight as you're moving your hips during your strength training. This way, when you translate into your running, it'll translate well, right? Your core will just automatically stiffen as you're running, and will provide a little bit more stability, because if you're getting in front of the hip pain, likely there's an instability. So you want to work on stabilizing, right? Deep hip muscles, we got to get them stable. Glutes, we got to make sure they're firing, because we call this is a motor planning issue, right? You could be having a difficult time activating specific muscles, deeper muscles that are going to help to stabilize your hip during your runs. And if these muscles go dormant or are inhibited because you're not aware of that firing, like it's a neuro thing as well. You're not aware of firing that pathway. During your strength training, if you go slow and controlled, it'll help this motor pathway of firing these deep gluteal hip muscles that will help to stabilize your hip. But it's a serious thing because, and now I'm just rambling on, but if you've made it this far, I hope you're getting something out of it. It's a serious thing because labral tears can set you back, require surgery. They don't always require surgery. People live with labral tears, but not a great. It takes a while for blood to, it doesn't have its own blood supply, so the cartilage there, so it takes a little bit to heal. So super important. Be super mindful. If you're always making left turns, if you're running on like a cambered, like at the road, it's not flat. But anyway, thanks for watching. Leave a comment down below. Let me know what you're dealing with, what you would like the next video to be on. I just make videos based off what I see in the clinic, and what I see athletes dealing with that can hopefully help you out. So best of luck, and see you on the next one.